Handling dental emergencies, first aid tips for common issues. Dental emergencies can happen at any time, and it's important to know how to handle them quickly and effectively. Whether you're dealing with a knocked out tooth, a cracked tooth, or severe tooth pain, knowing what to do in the moment can make all the difference. In this video, we'll discuss some common dental emergencies and provide first aid tips to help you handle them until you can see a dentist. 1. Knocked out tooth. One of the most common dental emergencies is a knocked out tooth. If a tooth gets knocked out, it's important to act quickly to increase the chances of saving the tooth. First, pick up the tooth by the crown, the part that usually shows in the mouth, and avoid touching the roots. Rinse the tooth gently with water if it's dirty, but do not scrub it. Try to place the tooth back in its socket if possible, making sure it's facing the right way. If you can't reinsert the tooth, place it in a container of milk or your saliva to keep it moist. Then, see a dentist as soon as possible, ideally within 30 minutes. 2. Cracked or chipped tooth. If you have a cracked or chipped tooth, rinse your mouth with warm water to clean the area. Use a cold compress on the outside of your mouth to reduce swelling and take over-the-counter pain medication if necessary. Avoid chewing on the side of the mouth with the cracked tooth and see a dentist as soon as possible. Depending on the severity of the crack, the dentist may recommend a filling, crown, or other treatment. 3. Toothache. Toothaches can range from mild discomfort to severe pain and can be caused by various issues, including tooth decay, gum disease, or an abscess. To alleviate the pain, rinse your mouth with warm salt water to help clean the area and reduce inflammation. Over-the-counter pain medication can also help, but avoid placing aspirin or any other medication directly on the tooth or gums, as it can cause burns. If the pain persists, see a dentist to determine the underlying cause and receive appropriate treatment. 4. Lost filling or crown. If a filling or crown falls out, clean the inside of the crown or the cavity in your tooth with warm water and try to place the filling or crown back in its original position using dental cement or temporary adhesive from the pharmacy. Avoid chewing on that side of the mouth and see a dentist as soon as possible to replace the filling or crown permanently. 5. Bleeding gums. Bleeding gums can be a sign of gum disease, which can lead to serious dental issues if left untreated. To stop the bleeding, rinse your mouth with warm salt water and apply pressure to the area with a clean cloth or gauze. Avoid brushing or flossing the area until the bleeding stops. If the bleeding persists or is accompanied by pain or swelling, see a dentist for a thorough examination and treatment. Dental emergencies can be scary, but knowing how to handle them can make a significant difference in preserving your oral health. By following these first aid tips for common dental issues, you can alleviate pain, reduce swelling, and increase the chances of saving your tooth until you can see a professional. Remember, it's important to see a dentist as soon as possible after a dental emergency to prevent further complications and ensure proper treatment.